Hello, everyone. My name is Elizabeth Garcia, and today we're going to do the population level health education intervention. This is the presentation. This is for Cal State San Marcos, Professor Judith Fiddler, for course number 447. Health-related problems and issues. For the population that I've done this in, it's San Fernando Valley, but more specifically I did like Sun Valley, Pacoima, and San Fernando City, more the east side of the valley. It's for the issues that I found most prevalent were nutrition and weight status, diabetes, and respiratory diseases and substance abuse. The significance of these health problems, obesity has been on the rise. Between 1999 and 2009, obesity went from 13.6% to 22.2%. This is according to LA County Public Health in 2012. Boys and Girls Club in San Fernando has classes that are dedicated to getting children more active and teaching better eating habits because of the rise of childhood obesity. You'll be able to see they have on their website, they have a multitude of programs and classes that children and their parents can go to. And I did find that there was a few more on activity and nutrition because of this. And diabetes also continues to be on the rise. Between 1997 and 2011, it went from 6.6% to 9.9%, which is over 685,000 adults in the country that are now affected. LA County Public Health in 2012. The poor air quality in Los Angeles County and the surrounding areas are contributing to the increase of hospitalizations for respiratory disease and breathing issues. Right now, specifically what's going on in Southern California and in California in general is all the fires that we're having. And I have noticed in the hospital that where I work here in the San Fernando Valley, there has been quite a rise in the hospitalizations for respiratory disease. But it's not just now. It's not just now that the smoke because of the fires. It's pretty much always happening here in LA. Our polluted air, it's really causing an issue. There's a lot more asthmatic kids, and it happens most in the summer. And then the overall number of treatments admissions for substance abuse in 2012 was 45,612. That's according to the National Institute of Drug Abuse. About 18% of the homeless population in Los Angeles County have substance abuse issues, according to the Los Angeles Almanac in 2015. So these are the four things that I found. However, I wasn't going to teach a class on all four of these subjects. So what I was able to do is I was able to incorporate obesity and diabetes together because their main thing in common is nutrition. So according to Healthy People 2020 goals and objectives, health and nutrition. According to Healthy People 2020, the main objectives are to increase nutrition standards for foods and beverages provided to preschool-aged children, increase the number of schools that do not sell or offer calorically sweetened beverages. And the goal is to promote health and reduce disease risk through the consumption of healthful diets and achievement and maintenance of healthy body weights. And as far as diabetes, some of the objectives set by Healthy People 2020 were to reduce annual new cases of diabetes diagnosis, reduce the death rate among those with diabetes, and reducing the rate of cardiovascular disease deaths in persons with diagnosed diabetes. And their goal is to reduce the disease burden of diabetes and to improve the quality of life for all persons who already have it. Respiratory issues. The objectives for the issue is to reduce asthma deaths among children and adults, reduce hospitalizations, and emergency department visits for asthma. Their goal is to promote respiratory health through better prevention, detection, treatment, and education efforts. As far as substance abuse, the objectives are reduction of adolescents who report that they rode in the last 30 days with the driver who had been drinking alcohol, increase the proportion of adolescents that never use substances, and increase the proportion of children and teens that have refrained from using alcohol and marijuana for the first time. Their goal is to reduce substance abuse, to protect health, safety, and the quality of life for all, especially children. As far as key stakeholders, Erica, who's a volunteer, stated that there has recently been an increase in the request for healthy eating programs and exercise programs by the parents of younger youth, primarily in ages 5 to 12, which I think that's why they've increased the number of programs that they have that do um, narrow in on healthy eating habits and exercise. And Dr. Delka, one of the physicians that I work with, stated that the most common reasons for hospital admissions are those related to poorly managed diseases like diabetes, hypertension, heart disease, and respiratory issues. So basically, it's things that people already have, diseases that people already have, they're poorly managed. So education, lots of education is needed for these people, the community in general. As far as population stakeholders, Ophelia, who's a mother of 2 girls in Sun Valley, worries about her daughter's weight, especially due to her family history of obesity, diabetes, and hypertension, and is trying to find ways to incorporate a more healthy lifestyle for them. And this is common among the community. I know that's with the culture aspect of it. I believe they were Hispanics. They said that it was hard. I remember having this conversation with Ophelia. She said it was difficult because food is love in their family. Everything is, you're celebrating something, you feed them. They don't feel good, you make them something to eat. So everything's surrounded around food, and it makes it quite difficult. And then Samantha, 23-year-old female in Pacoima, stated that almost everyone she knows does some type of recreational drug. The most common are marijuana, alcohol, cocaine, and now with more frequency, prescription Xanax. Apparently, children are mixing Xanax with alcohol and other drugs, and it's become like a common thing, or it's like, oh, they call it Xannies. They go out on the weekend, drink a little bit, and do a couple of Xannies. That's how they call it. As far as the framework, precede, proceed. Defining the ultimate goal as far as precede, it's decrease obesity among children. Identifying the issue, poor eating habits, decreased physical activity. Predisposing factors, that's knowledge deficits, and that's not only for the children, that's also the parents. Barrier identification, community and family habits of poor eating habits. So it's the family, it's the culture, it's the community. There has to be a change in that. School, home, and even in television, everything that children are seeing is surrounded around food, and it's always fatty food. You don't see a salad looking amazing on the television screen. You always see a big juicy burger with cheese and fries and all this stuff surrounding it. And as far as proceed, implementation, interactive education with incorporation of choices. I feel like this is very important for children. They need to be interactive for them to really pay attention, for them to really learn. And you have to give them choices so they feel like they're not just being told what to do, but they have the choice. And I believe they'll make better choices when they're given the choices. Process evaluation, specific questions after sections of teaching with the children. So once we go over something, we go over a fruit, a vegetable, a sugar, a drink, and things like that. Ask them, is it good for you? Is it bad for you? Do you think it has a lot of sugar? Do you think it has a lot of calories? Do you think it's good for you? Do you think it's bad for you? Things like that. Impact evaluation at end. Again, we review with the children and ask questions. See what stuck, what didn't stick. See if it seems like the information was well received or not. As far as outcome evaluation, short term, if it was effective, it was well received. With these children, I actually took 2 of my nieces with me. One of them is 8 years old, another one is 10 years old. So they were my little helpers. And I felt it was important for them to see this as well because they do have a little bit of a weight issue as well. And it seemed that it was well received, not just with them, but with the other children that were involved as well. Long term, with time, we'll be able to show whether it was effective or not. And I am happy to say that as far as my nieces, they have been making a little bit more choices, better choices. They do ask me to go to the store. Hey, auntie, can we go get some fruits, some vegetables, cut some up? Their new thing is making fruit salads. So we will see in the long term. I can't necessarily see the children that we were at the Boys and Girls Club with, but I can see it with my nieces, whether it's stuck or not. Issues, education, and practice. Specific behaviors that must be acquired or strengthened. Well, we need to increase physical activity, reduction in sugar intake, increase fruits and vegetables intake, and reduction of sedentary lifestyle. Information or skills needed for change, general understanding that too many calories leads to diabetes, obesity, and tooth decay. And then we want to know what eating healthy really means and the importance of exercising. Needs assessment of the population, the community and parents all have to be on board with the plan and work together to make the changes for our youth. Resources, personal and material needed for changes. Well, effort, time, commitment, and a true understanding in the value. Personal choice to switch fried foods to steamed vegetables. And it is cost effective. I know that sometimes we're thinking, a dollar burger is less expensive than going to the store and buying a full course meal, but we don't necessarily have to do that. Something that we can do is just get a couple of vegetables, get whatever's on sale, saute them together, and have a little protein on the side. Whatever is on sale, sometimes chicken legs or something is on sale, bake that up and put it on the side. These are choices, these are options that we can actually offer to the community, the parents, and the children. And they don't have to be just a plain salad that doesn't taste good. It could be made tasty. Nursing health community services needed to affect change. Well, they need to know that they can go to their school nurses, the community clinics that give free basic care for low income, school lunch tickets, and recreational parks do have summer lunch programs, which they do give free lunches. Usually it's Monday through Friday. And you go sign up. You go ask your local park and see if they have that program during the summer. And a lot of them do here in LA County. Intervention. Well, we needed to tackle the nutrition and weight issue first with children at the San Fernando Boys and Girls Club. Again, I took my two nieces, 8 and 10 years old, as the objective stated, we are to increase nutrition standards. We're going to work with a group of children aged 5 through 12 and talk to them about healthy eating habits and increasing activity. We want to teach children in a way that they understand, and we need to make it fun. I feel like it's important to add interactivity factor for children. The hands-on aspect of the education will promote health, will promote learning, and in turn promote health with these children. We need to allow them to pick from a variety of fruits to make their own fruit bowl, teach them about how much sugar certain foods have. I actually took a little visual. I took a bag of sugar. It was in a Ziploc bag, and I put 11 teaspoons in there, and I took a can of soda, and I showed them, this is how much sugar is in that can of soda. And nobody really thinks of that. It's just so much sugar is in that one can of soda. So some of the kids were kind of blown away by that. And I also took a game called Food Bingo. And at the end of it, whoever answered the most questions correctly based on the little cards that I filled out for them to answer, I actually gave away the Food Bingo. My nieces weren't too happy about it, but we purchased it for them as well. With every food that came up during the Food Bingo game, we discussed with them the pros and cons of each vegetable, each fruit, whether the burger was healthy, the fries were healthy, the carrots were healthy, things like that, because there was a variety of foods on this Food Bingo. The budget, well, I don't think it was very much. The total was $36.50. There was fruit that I spent $18 on, sugar, which cost me $1, soda, it cost me $1, water bottles, $3, because I did offer them water, because substituting water for all the sweet and sugary foods that they have is super important, and I try to push that as much as possible. And then the Food Bingo game, which cost me $13.50 on Amazon. So ultimately it was $36.50. But it was an experience that my nieces got to have with me as well. And these children seemed to really enjoy the whole process. Evaluation and measurement. What were the goals and objectives for this project? We wanted to educate children on nutrition, making better choices with food, and increasing exercises. How to measure success or failure for the intervention, short term. Ask them what they learned and if the information was retained. I really wanted to see if these children were really paying attention, or if they were just excited to eat the fruit and play the game. What type of evaluation would be used to measure short-term goals, and what type of evaluation would you use to measure long-term goals? Well, short-term, are they going home with more confidence and healthier eating habits? I requested them to teach me. I requested a teach back method. So I show them a picture on the Food Bingo. Is it good? Is it bad? Tell me what you think. And then why is it good? Why is it bad? Long term, this will require time. Watch to see if they choose water over sweetened drinks more often. See if they put more vegetables on their plate as opposed to the starchy, heavy, cheesy, calorie and high calorie foods. And this is something that I can do with my nieces at home. So this is going to work out great for me. As far as the children that were there at the Boys and Girls Clubs, probably won't be able to see them often unless I go every week. Instead of just offering fruits, I think I should have brought maybe some vegetables as well. Like, I know some kids like to have cucumbers and baby carrots and things like that. I only took fruits, and I just took a bunch of sugar, healthy sugar for them, I guess, but I just took a bunch of sugar. So for next time, I feel like maybe we can work with some vegetables as well. I would go a week ahead of time and get a list of children that will be there and have them list one of their favorite fruits or vegetables. And maybe that can, based on their answers, if there's a lot of answers that are a coincidence, I can choose that fruit and vegetable to take it to get more of the kids involved and like it a little bit more. And also inform the parents ahead of time, and because they might want to join the class. There are a lot of parents that are struggling with better eating habits because they don't have the good eating habits either, and they're teaching their kids bad eating habits, and they know this is not just something that it's on observation. This is something that they feel upon having these conversations with my siblings as well, because they all have kids. They feel like they know that they're doing their kids harm because they don't have the best eating habits. And these are my references. Basically, most of the stuff that I used was from Healthy People 2020. It was an interesting and fun little project. Again, I took my nieces with me, and they really enjoyed it. I think the children really enjoyed it, and I think they really liked that there was a little winning of the bingo game at the end. Again, my name is Elizabeth Garcia. Thank you so much for watching. I hope this will suffice. Thank you.